Hey, how was your day?
Not good.
What, problem with a patient?
Not exactly. The problem is balancing patient care with all of the paperwork and the rules and the requirements. I'm gonna go lay down for an hour. I haven't been sleeping well. I keep having all these strange dreams.
You don't look happy. What's been troubling you?
I keep having these strange dreams.
Tell me about them.
Well, last night, I dreamed I was a used car dealer selling cars out of my driveway. All the customers I sold cars to were yelling at me. They're mad at me because I didn't tell them that the extended warranty wasn't covered in the selling price and that they would have to pay extra. So I had to reimburse them. That's all I can remember.
Have you been thinking of buying a car with an extended warranty?
Mm-mm.
Have you been worried that your patients are upset with your services?
No, my patients really like me. I actually have one of the highest satisfaction scores in the department. But I do remember getting this memo about advanced beneficiary notice. I've been so busy, haven't had time to read it yet. Do you think that could be what's bothering me?
Yes, I think that's the problem. I can help though. Let me summarize the important points of the advanced beneficiary notice, or sometimes called the ABN.
I could use a clear and concise summary.
In order to bill a traditional Medicare patient for most outpatient items and services that may not be covered by Medicare, the patient must receive an ABN before the items or services are provided. If the patient doesn't receive the ABN and the item or service is provided, then the provider is responsible and can't collect payment.
What happens if we're sure the services won't be covered? Should we still give an ABN?
Unless the item or service is never covered by Medicare, like cosmetic surgery, hearing aids, and exams, routine foot care, and personal comfort items, you should give the ABN. The patient will probably want you to still try to bill Medicare, which is the patient's choice.
How do you know if an item or a service isn't covered?
There are software programs that link Medicare coverage limitations using the diagnosis code and the CPT code. However, many coverage limitations are not linked to diagnosis codes, so a provider should try to review the national and local coverage decisions that affect their specialty and note when certain services are continually denied and an ABN may be appropriate.
What about screening tests? Sometimes they're covered, but there are limits, like 1 mammogram a year. Should I still give an ABM for them?
It makes sense to give an ABN to patients receiving screening tests because the patient might not remember whether they met the time frame for the test.
That makes sense. But what if the patient is sent to another provider for the service? Who gives the ABN?
If possible, letting the patient know before they make plans to go to another provider for services would be best from a patient satisfaction perspective. This is especially important if the physician's office is taking a specimen and then sending it out to an outside lab, since the patient will never see the other provider.
That was really helpful. I hope I can remember it all.
I know, it's a lot to remember, but sometimes all you have to do is remember to ask the question.
Thanks. I can remember that. Okay, given your history of high cholesterol, I'm going to go ahead and order what's called a C-reactive protein test. Now, the more sensitive version of this test measures inflammation and is better for identifying cardiovascular disease, but unfortunately, Medicare doesn't cover it. Would you be willing to pay out of pocket?
It sounds like you think it's pretty important, but how much does it cost?
My assistant can check and tell you exactly. I think it's between $50 and $100. If you decide to go ahead with the test now, we'll give you an advance beneficiary notice, which informs you that you might have to pay for the test.
That's okay. It sounds like you think it's good for me.
Yeah, I do. I also want to order a PSA. When was the last time you had one?
Gee, I don't remember. It was about a year ago with my last doctor.
Okay, well, Medicare only covers one PSA test a year.
I think it was over a year ago.
Do you want us to call your old physician and find out?
I just want to get it done now. I'm pretty sure it was over a year ago.
Okay, well, if we go ahead with the test now and it's not covered, you will be responsible for payment. So you'll have to sign an advance beneficiary notice just in case.
That's fine. Thank you for taking the time to tell me what Medicare covers and what it doesn't.
You're welcome. At our practice, we believe knowledge is power. Hey.
Hey, how was your day?
It was wonderful. It was just like a dream.